Hi everyone, welcome to our webinar or info webinar this afternoon. The title is Impact of Dietary, Metabolic and Microbiome Related Factors on Plasma Cell Disorders. My name is Gabriele Colasurdo. I'm the Manager of Education and Patient Services at Myeloma Canada. I'm happy to be here today for this presentation. Before we start, we'll just go through a few things. This webinar actually, or this presentation, was actually supposed to be part of our national conference that obviously was canceled earlier this year. And so, you know, this is I know this is a topic that many people want to learn more about, namely the microbiome and the research that's coming out of there. But diet and metabolism is also something that a lot of people have interest in. So right before we get to our presenter and to the presentation, I'd just like to thank our sponsors for helping us out with these educational info webinars. Without their help, it would be very hard to do these. So thank you to Amgen, Binding Site, BMS, Janssen, Takeda, and Sanofi. You know, we're going to learn a lot of information today, and it's possible that you might want to go over certain things again. So have no fear. The webinar is being recorded. It will be posted on our YouTube channel. So you can get there by simply going to youtube.com. You see at the top here. In the search bar, click on myeloma. You type in Myeloma Canada and click on search, and one of the first links you'll see is our channel, Myeloma Canada. You'll see our logo there. You click on subscribe, and you'll be able to subscribe to our channel. You'll also see a little bell icon, and if you click on that, every time we put a new webinar on or a new video, you'll get a little notification that pops up on your phone saying, hey, there's something new, come see it. So that's a good way to stay up to date with everything. From our website, you can also access our YouTube channel and our educational videos. So myeloma.ca, click on the resources tab right there. The menu will open up, and you simply just click on educational videos. That'll forward you off to the YouTube channel that I just showed you, and there you go. Lastly, before we start, how do you ask questions? So you can ask questions with your GoToWebinar software, whether it's on your computer, on your tablet, or on your phone. There should be some icon or some button that says questions on it. If you click on what you see here on my screen is what it looks like on a PC. It might look similar on a Mac. On your phone, it'll be just a little icon. You click there, type in your question, click on the send button. I'll receive the questions, and at the end of the webinar, we'll be able to ask those questions to our presenter. So without further ado, I'm going to pass off the microphone to our presenter, Dr. Urvi Shah, who's an oncologist and researcher at Memorial Sloan Kettering Cancer Center in New York. Dr. Shah, thank you so much for taking the time today to come and teach us a little bit more about all this.
Thank you so much for having me, and I'm really excited to talk to all of you about this. I know that this is a topic that's very personal to many patients, and they want to know how can I take control, or what can I do to make a difference. And it is a bit difficult sometimes because there's so much data out there, and how do you really parse through it? Is it worth, you know, changing so many things or not? And I think this is a summary of the data that's available for plasma cell disorders, and a little bit outside of the plasma cell disorder realm, where there is truly data also available that's strong evidence. So I just want to start with the outline, where I can go over some of the survey responses of, like, you know, I think quite a few of you did respond to the pre-talk survey, and thank you for that. And we'll go over an overview of plasma cell disorders, the global incidence, and how it's, you know, different in different countries, what the importance of nutrition is, obesity, diabetes, diet, and then supplements. I know a lot of you had questions on that as well, and microbiome, which is a very upcoming field and topic, and everyone always wants to know more about that, though it's very early in the myeloma space, so we don't have a lot of data, but everything that's there I will share with you today. So this was just, some of the questions I thought y'all might want to see responses to. But since your diagnosis, have you had any questions? And the answer is pretty much a resounding yes. Like, everybody wants to know what they can do to control their disease or be in control of it or take charge. And then how well has your oncologist been able to answer this? And I see that only about 10% of patients feel like they got all their answers from their oncologist, which is a pretty small number, even though many said that they answered some of their questions. And then this is, another question is like, if you made changes, where did you make them from? Or like, what was was it online? Was it television? And was it advice from a nutritionist? So it seems like a lot of the patients do say that, about 40% have gotten advice from a healthcare provider or a nutritionist, but the rest have, found advice in other places. And I think that's something we need to do better about to make this evidence available more clearer to the audience, so that they know what is available to them, and it's not just looking up online. So this was another question. It was a little bit long, but I wanted to bring up a few things like whole fruits, vegetables, and leafy greens, whole grains. These are things that we do think about them as pretty important, but we see that only about 20% to 50% of patients before their diagnosis and even after have it more than once daily. And I think that number is very small, but it's encouraging to see that there are some improvements after the diagnosis, where it seems like the patients have moved towards trying to eat better and think about it post their diagnosis, which is, I think, a good sign. Like, you can see that sugary beverages also, although there were more patients like using these at some times, like frequency, many of them said that they've never used it after their diagnosis. And I think that's great. So just a little bit about plasma cell disorders. I'm sure you're all aware and so I won't go into details, but to give you an overview, you have MGUS, smoldering, and multiple myeloma. And MGUS is usually not treated. It's very small number of patients that actually progress to myeloma. And this is diagnosed more like because you go to your doctor for something else, or because there are abnormal, the protein is abnormal in the blood, and so that's why it's noticed. Then smoldering myeloma is a little somewhere between multiple myeloma and MGUS. The burden of the plasma cells is a bit higher, and you also have about 10% per year who might progress to myeloma. But there are a lot of things that risk stratify patients and other things that matter. And then, most of you know what multiple myeloma is and how it requires treatment. We've come a long way in multiple myeloma treatment. And so, this is just a summary of the treatments that are available to show you where, survival was in the 1960s and 70s was significantly lower than it is now, and even now things are improving, where we have so many more options coming up. So I think this is very promising and forward-looking in the sense that we do have a lot of options for patients going forward, and survival has significantly improved over these years, where the median is now, like, the average survival is over 10 years now, which was not the case just 20 years ago, even 10 years ago. So this is a slide showing you the global incidence of myeloma, and as you can see, the highest incidence is in countries like Canada, the US, UK, Australia, and the question is, like, why is there more myeloma in these countries compared to others? One thing you could argue and say is that they're just better at detecting myeloma, and better at capturing the data well, because they're developed countries, and so we see more of the disease here. And that may be one argument, but there are other countries that we would think that capture data well as too, that have a reduced incidence. So there are many factors, but I'm going to focus on diet, environment, and things like that, and whether that may have something to do with these changes. The other, some people have also proposed that maybe living at higher altitudes means less UVB rays, and with that means less vitamin D, and that could be a reason as well. Though it's hard to prove these things, so there is some data on it, but it's never going to be like this is a clear-cut reason. Also, unfortunately, there is a rising incidence of myeloma in young adults, and what this can be attributed to could be, obesity, diet, or other environmental factors. But we do see like about a 2% annual change per year of younger population. The older age of diagnosis hasn't really changed over the years, but at the younger age group in the 30s to the 40s, which is not the typical age for myeloma diagnosis, has gone up. So why is nutrition important for cancer, and especially in myeloma? I think there are three parts to it. One is prevention. So if a patient has MGUS smoldering, or even before they get diagnosed, you want to reduce the risk. While you're in treatment, many people might say, I already have the cancer, why should I change anything? But if you already have it, but you have fewer comorbidities, you're going to have fewer side effects, and you can get the right treatments on course and on time, and that would improve outcomes as well. And then having less of all these other comorbidities definitely helps as well for the physician and for you to manage and be able to go through the treatments well. And then the last thing is, once a patient is in remission, does it matter then? And I would argue that it does in some ways, because again, you can reduce the risk of other medical problems, other cancers, and also potentially reduce the likelihood of the cancer coming back in the future. So this is just overall cancer. This is not only myeloma, but I just wanted to show you that preventable causes of cancer are very significant numbers. So then about 1/3 of many common cancers can be prevented, and a preventable cause plays a role in many cancers. I know that, for myeloma, it's not as straightforward. And if it was that easy, we could all say like, oh, change this or eat this one thing and everything will change. But unfortunately, we don't have that. And it's a little more complicated to study that in a cancer. But at least, these are things that we need to think about. So this is, a patient that I had seen once, and I thought it was interesting to show you, because there are so many medical comorbidities, and on top of that, like other medical problems, and on top of that, the patient has multiple myeloma. So if we're trying to, think about what chemotherapy to give, are they eligible for clinical trials? What can we do? All of those things are going to be harder when we are managing so many problems at the same time. Also, what I've done is I've highlighted in green things that potentially might have been impacted if the patient had probably had a healthier lifestyle going into the disease or throughout their lifespan, and maybe if they consider changing it now. You could argue like even these other disorders like deep vein thrombosis or things are associated with some of these other disorders, so they may never have happened if the patient was healthy. Now, this is just an extreme example, but it's not uncommon for me to see such patients in my practice. So what we want to do is, cancer is basically your immune system being overwhelmed by these cells, where your immune system is no longer able to take care of it. And that's when patients develop cancer. And trying to understand that in terms of how to manage it is like, you want your immune system to be better or boosted. It's difficult to fully change it. Some of it is inherent intrinsic properties and things, but some of it can be related to lifestyle, nutrition, and diet. And so if you think about the T cells or your white blood cells and the tumor, what you do see is that actually all of our bodies, even those who don't have cancer, are making cancer cells every day. But what happens is our white blood cells remove them. So even though we have these cancer producing cells formed, our immune system is able to get rid of them. But what does happen sometimes is that the immune system is not functioning as well, and it's impacted by numerous factors. And then this equilibrium is disrupted, and what you see is that the patients develop cancer. So now I'll just talk a little bit about obesity and cancer. And there are 13 cancers that have been very clearly associated with obesity and overweight, and multiple myeloma is one of them. So it's not something that we don't know about or whether it's possible, but there is a lot of data on this, and I'll quickly show it to you as well. So this is just some slide about how many people in the world are obese and where are the obese people. And what you can see is that the US, Canada have about more than 30% of the population is obese or overweight. And this is just overweight, and overweight more than 70%, 60% of the population is. So that's really high numbers where, you know, we're seeing malnutrition, but in the opposite direction, not underweight, but overweight and obesity, and those are problems as well. So how could obesity lead to cancer? This is just a general thing. It's not specific to myeloma, but the causes with myeloma also not very different. So the fat cells basically make hormones and other cytokines and things that can promote cancer formation, and then they also make like growth factors, and fat cells lead to inflammation, and inflammation leads to the cytokines that are released that again encourage cells to divide. So there are many other reasons, and in myeloma as well specifically, but these are just the overall reasons why this happens. And insulin and insulin-like growth factors, the IGF-1, that's what has been associated also with fat cells. So these are some studies in myeloma. I just put, you know, all of them so you get a comprehensive understanding, but just so you know what to focus on. I know this slide is a bit busy, but things that you can look at is the odds ratios and the hazard ratios. So the ones in red are significant because they don't cross 1. So if any of these numbers cross 1, then it's not significant, but it's a trend towards that. But if it doesn't cross 1, like these numbers, then that means the risk is significant. And what it's showing you here is that there's an increased risk 1.8 times for MGUS to develop if a patient has a BMI over 30. This study was not significant, so I will not go into it. This study showed that if the midlife BMI is over 25, so anybody who's overweight or obese, the risk goes up almost by 2 to 3 times for progression from MGUS to myeloma. So if somebody already has MGUS, I think one of the important things they can do for themselves is try to move towards a healthier lifestyle, and maybe, you know, see if they are overweight or obese, consider changing their nutrition towards foods that can help with that as well. And this is another study showing MGUS to myeloma progression, and it's the same thing, that it's almost 2 times as likely to progress if the BMI is over 30. So this slide is basically looking at what about patients who already have myeloma, and does it increase the risk of death, or does it increase the risk of myeloma? So the first 3 studies are for whether it increases the risk of myeloma, and then these 2 are whether it increases more like death related to myeloma. And what you can again see, whatever is in red is significant based on these numbers, so you can focus on that. But patients who have very high BMIs have an increased odds of developing myeloma. And then the same thing with mortality. As the BMI goes up, the mortality risk also goes up. So if you already have myeloma, this is another thing where if you want to improve outcomes, this is something to think about. Now, it doesn't apply to everybody, of course, but it's just things, I'm just sharing all the available information so you can see what applies to you or not. This is another metabolic disorder is diabetes. And, there have been some studies that have shown that diabetes is associated with increased risk of cancer. But, and this study looked at all cancers. So it didn't just look at multiple myeloma, but it looked also at multiple myeloma. And what you see is multiple myeloma is about 1.6 times more likely in somebody who has diabetes than somebody who doesn't. You could argue, though, that is it just because the patients who have diabetes are more likely to see a doctor, and because they're more likely to see a doctor, they're more likely to get diagnosed because they have other medical problems that confound it, and that may be the case. And but the data is also showing some of it, where there is an increase. So we actually looked at this as well, and what you can see is that what we try to do is look at it overall, if prior to the diagnosis of their cancer, if they had myeloma, and then if they had myeloma, the diabetes diagnosis within a year prior to the diagnosis of their myeloma or AL amyloidosis or MGUS, and then if the diabetes diagnosis was greater than 1 year prior. I would recommend focusing on the greater than 1 year prior, because that's the population that you could say is not confounded by the increased risk where they are more visits or things like that. And what you can see is that the AL amyloidosis patients have an increased risk almost 1.6 times than somebody without diabetes. Similarly for MGUS, though MGUS is an asymptomatic disorder, and so it can sometimes be that, is it just because they are seen more in the hospitals or in clinics, and that's why the doctors do tests and find the MGUS, so maybe this is not as relevant. I have not put the studies just because that would be too much, but these are summaries of what other studies have shown, that diabetes worsens outcomes. The diabetes increases the risk for steroid-induced hyperglycemia. And, as you know, most regimens for myeloma include steroids, they include dexamethasone. So if somebody's diabetic or pre-diabetic already, they're at risk for this complication, and with this complication, kidney problems or other things. And then diabetes damages, many organs, and these also are the same organs that can be impacted by myeloma and its treatments. So having diabetes under control is something that also will definitely improve outcomes in myeloma patients. The studies are small, and they're not really big studies, but I think it makes sense, and so this is something to think about. And then, how does diabetes increase the risk of cancer? So I think that I kind of mentioned this to you in the previous slide, where I said, could it just be correlation that those who have all these same risk factors have diabetes, and those same risk factors are what causes cancer? And well, that could be the case, but it is also possible that these risk factors lead to diabetes, and the high sugars and the high insulin levels lead to cancer. So it is unclear always whether we know which of the two it is, but either ways, there is an association with it. Now I'm going to switch gears a little bit and talk about these big population studies that looked at diet and risk of cancer. These are massive studies where you can see how many patients. There were about 61,000 patients in the study. This is from the UK. It was published in 2014, so the data is a bit old, but it's still interesting. So they looked at patients in different populations. One thing you have to keep in mind, though, is nutrition studies are very, very hard to do, because you rely a little bit on what the patients say they eat and what they don't eat, and that can sometimes not be perfect. We all know that, like, somebody who might, classify themselves in this might be predominantly vegetarian or things like that. So they have specific ways, obviously, that they're classifying it, but at the same time, these studies can be very hard to do, and that's why I think a lot of physicians and healthcare providers are a bit skeptical to make absolute recommendations based on a few studies, because there are other studies that don't fully show this increased risk at this level. So this study basically showed that patients, individuals who had a completely plant-based diet had 19% less cancer, and vegetarians had 11% less cancer when they compared to the meat eater group. And then specifically for myeloma, they actually looked at that too. And what they saw was that about 53 in the meat eater group, about 53 patients developed myeloma. So that's 0.1% of this 32,000 population. And then because this number is too small to look, they combined these two and said how many out of this population developed myeloma. And there was only 5 out of 20,000. And so it's almost like 0.02% of that population compared to 0.1%. So this is almost a 77% risk reduction. Now you have to understand this is relative risk, meaning that if the risk is 0.1 for the general population, then it's 77% less of 0.1. So it's already small, the risk to begin with, and the risk is just getting smaller. So it's not like 77% compared to 1%, it's more like 0.1 compared to 0.02%. But it's not an insignificant risk reduction. You could though argue also that the number of patients are too small, so is this really significant? But the number of patients here, the participants, I think are a big enough number, and we don't have bigger studies, so we have to go with what's available in the literature. This is another study looking at the Adventist health population. As you know, many of them are very much, are very often vegetarian or vegans or like some form of that. So it's a very good population to study incidence of cancer. And what they saw is that those that followed a completely plant-based diet had 16% less cancer. Those that followed a diet which included dairy and eggs had a 7% less risk, but that's not significant. So this is another study showing similarly. This study, again, another big study with over 42,000 adults. What it said is like it looked at each person's diet and it calculated a score based on how much of their food is plant-based, and that score basically defined and then they divided the population based on that score into these 3 groups. And what they saw is that those that had a higher score, meaning they ate more plant-based foods, had less cancer overall. They didn't look at myeloma specifically, so I don't have that data, but they looked at overall cancers, and I thought this was also interesting or in line with all the other data. Now I'll focus on myeloma, and these are 2 big studies that were recently published, this one actually this year. And what it looked at is pre-diagnosis dietary pattern and survival. So this is what did the patient eat before they were diagnosed with myeloma, and what was the likely outcome in these patients when they develop myeloma. So out of about 116,000 women and 49,000 men included in the study, 423 patients developed myeloma. So it's a small number, but amongst these, they had also, because this is an old study starting like a long time ago, they had follow-up for a long period of time, and they could see how many patients lived versus not. And then they could see, based on their diets, was there a higher risk of death for, based on what dietary pattern they followed. So these are just different ways in which a researcher can look at dietary patterns, but also things that patients do follow sometimes. And what they saw is that, this is a healthy eating index where you measure like different components of a diet and say, what is the score? And based on that score, you decide, is it a healthy eating pattern or not? And so higher scores in all these healthier diets means that the person's eating better, and those who ate better had a 15 to 24% lower had 15 to 24% lower deaths due to myeloma. And when they looked at unhealthy dietary patterns like the Western diet, or they looked at diets that increase inflammation or increase insulin levels, and they showed that there was a 16 to 24% higher deaths due to myeloma in this population. So you can really see that just this is an overall, over their lifetime, how they're eating can affect mortality. This is another study that was published in 2019 from the same group, but it was looking at the data a little bit differently. And what they looked at is the dietary pattern and risk of multiple myeloma in these two large cohorts. And again, the findings are pretty similar, not as significant as the first paper I showed you, but they showed that inflammatory diets have increased risk of myeloma. In men specifically, it was significant, and it wasn't significant for women. But I don't think that that's, you know, that's just the not having enough power to detect it sometimes, and that could be what's impacting it. So I'll now focus a little bit on the data that's available for specific food groups, and you know, we can talk about that. So fruits and vegetables, we all hear about it, like the cancer-fighting properties and why it's important and everything, but this is actual data showing you why it's important. So here what you can see is that this was, again, a really large study where it took 14 other studies and it combined all the data to see what an overall combination of all these studies shows and what's the trend in terms of it. So this is a relative risk with fruits and vegetables in grams per day. And what they showed is that those that eat 600 grams per day, so I converted that into servings or cups, so it gives you an idea, that's about 7.5 servings per day, had a 14% reduction in risk of total cancers. And while all of these things are small, they're significant, and over a lifetime and with combining other things, I think, you know, it is an important consideration. The USDA recommends about 5 to 9 servings, so that's right about where this is. I think most people do not actually meet this goal, and some don't even eat fruits every day. And here they're talking about 7.5 servings of vegetables and fruits. So it could be either or both. I would obviously recommend both, but I think it's important to increase the consumption of these. And then the other, these are specific to myeloma studies. The problem is myeloma and MGUS, they're rare overall, so we don't have really large studies like the one I showed you with robust data, but these are just some positive studies that showed about a 50% reduction, some of them more like 70%, but you have to understand that the numbers are small. So even if we cautiously look at it, there's a 50% reduction in the risk to develop MGUS, for transformation from MGUS to myeloma, and to develop myeloma. And this is looking at just fruits only more than 3 times per week. So it's not even saying you should have 7.5 servings per day. It's just saying have it more than 3 times per week. And then you can see that. So I would urge everyone who is listening, if you aren't already doing it, at least more than once daily, you should be including these things in your diet. And then let's look at whole grains. So whole grains is another thing where, you know, a lot of, like, I think whole grains and grains in general have got a bad reputation because of carbohydrates. And what you have to understand is not all carbohydrates are the same. Refined carbs versus whole carbs are very different things, and what they do is also different. So whole grains are what is healthy and what you want to increase your consumption of, not the refined ones. Now, there were 2 studies that showed an improvement. One was from Italy. Again, the number of patients with myeloma, these were 2 studies in myeloma. It was about the same population in Italy, but they published 2 papers. And what you can see is that the odds of developing myeloma was about 50% less, 40 to 50% less in those that had whole grains more than 3 days per week. And you would think like, shouldn't everybody be having that much? Isn't it like this thing? But if you think about it, there are actually a lot of people who do not even in a week consume these things. So I think making a conscious effort to think about them is important. And then the same thing, this was a study from Iceland looking at the ages data. And you can see a 25% reduction with more than 5 times a week, so almost daily. What is the recommended intake? It's about 90 grams or 3 servings per day. So, maybe oats for breakfast, something for lunch, maybe, think about things where when you buy bread, you're thinking about whole grain bread, not refined bread or not brown bread. So there's a difference between brown wheat bread versus whole grain bread, because brown wheat bread is similar to white bread in the sense that it's just refined. But you want to look more at something that says in the ingredients and things whole grains, and that's probably better. Better than bread would all actually be the actual grains. So if you're going to eat brown rice or quinoa or barley or any of these grains, but you're actually eating the grain instead of eating it as bread, because bread grinds it up and it's not the actual grain where the fiber content is there. So just some information about why whole grains are good and why they're important and why we shouldn't take them out of our diet just assuming that they're like all other carbs. They have fiber, and we'll talk a little bit more about fiber and why it's important, but other things that they have are all of these things that are important for their anti-cancer properties. Zinc, selenium, copper. It has resistant starches, which basically feed your gut microbiome, antioxidants, lignans, vitamin E, and phytoestrogens. And this is how you can understand what the difference between a whole grain is and a refined grain. So the refined grain basically takes out the covering from the whole grain, and the covering is what basically has your fiber-filled outer layer with vitamins and minerals. And then the refined grain just has the starch and the carbs with very little vitamins and proteins. And then you're looking at the germ, which is the nutrient-packed core, which has a lot of, the important ingredients as well. So this is a slide I created just to get a sense of what are the different mechanisms by which fiber prevents cancer. And what you can see is that only plant-based foods have fiber. So you'll never find animal-based foods with fiber. But the increased fiber in a diet can lead to binding of estrogen in the colon and decreased estrogen levels in the blood. This is important for other cancers, not so much for myeloma, but like breast cancer and things like that. It decreases blood sugar peaks, like the sugars rise slowly, and those peaks decrease insulin resistance and the levels, and decrease insulin-like growth factor, which is considered a factor that increases cancer cell growth. And then here, this is a little bit about microbiome. So more fiber means more food for the bacteria that live inside us, and more food for them means that they grow better. And the ones that grow more with fiber are the carbohydrate fermenters and the butyrate producers. These are the good bacteria, and we want more of them in our gut. And what they do is they decrease endotoxins, they improve the intestinal integrity, they increase these metabolites called short chain fatty acids, which are butyrates and acetate, and these have actually anti-cancer properties and specifically inhibit pathways that are also important in myeloma. Increasing bulk also means decreased intestinal transit time, and decreased transit time means less time for the stool to sit there, and less time for stool sitting there means less time for it to interact and cause problems in the colon. This is more important for things, I think, like colon cancer than myeloma, but it's still important to think about. And then decreased fat, and because of decreased fat, there are decreased bile tolerant microorganisms and secondary bile acids, which are also considered to have a negative effect on overall health. So what is the recommended daily intake of fiber? It's about 30 grams from food sources. What I just mentioned to you before was whole grains is about 90 grams, and fiber recommendation is about 30 grams. So it's not that much, and obviously the whole grain is not only comprised of fiber, so it's probably much like less. So we have to think about that. But 30 grams of fiber, that would only a lot of people think they're getting their fiber, but only 5% actually do so based on some survey data. So the chances are that most of you are not getting enough fiber, and if you are, then that's great, you're one of the very few. What about fish consumption, and does that decrease myeloma risk? So there were 5 studies. These are not very big studies. The number of patients in them were all in a few hundred, I think, range. But this was one big study, one study that basically took all these smaller studies and combined all the data and said, what's the overall impact like with all this data? And if these horizontal lines cross 1, means it's not significant. So this study was not significant. This study was not significant. But 1, 2, and 3 studies were significant to show that fish decreased the risk. Now, the decreased risk is about a 35% decreased risk when you average, like you include all of these and adjust for the size of the study and everything. But then they also said that the lowest risk that they found is linked to approximately once weekly consumption. So not really that frequently. It doesn't mean that more fish is better. And so as patients ate more, it didn't really help. It may have even increased back the risk or reduced the benefit of it. And I wonder why this is, and some of it could be due to whether it is like more fish means like fish has been associated with toxins and things like that. So is it related to that, or is it something else? I don't think we really know. And why do we think fish might be beneficial? I think these are the 2 main things. It has the omega-3 fatty acids and vitamin D, which are both considered to be anti-inflammatory and important. So the omega-3 fatty acids, they inhibit growth in myeloma cell lines, they reduce neurotoxicity, they may alter the microbiome and increase butyrate, and also they are anti-inflammatory. But the sources for this can be from oily fish, it can be from, these are all the plant-based sources, and then there can be supplements. So these are the concerns with fish consumption, which maybe you could get from plant-based sources, but I think either of these are fine based on what works for you. We can quickly talk about vitamin D, and vitamin D2 and D3 are what many people get from the diet, but mainly vitamin D comes from the conversion by the sun's UVB rays, and because of that, it is a lot of myeloma patients have also been shown to be deficient. And so here is, I've just basically summarized each tile as like one study, and you can see what the data is for all these studies. And you can see that decreased solar UVB rays means increased myeloma risk. 40% and increased myeloma risk, and this may be due to decreased vitamin D, but we can't really prove it, but that might be. In this study of 100 patients, 40% were deficient, 35% insufficient, and only 25% normal. They've also, this is another study that found decreased survival in patients with low vitamin D. This study found increased plasma cells in the bone marrow of patients who had lower vitamin D. So this was the lowest, like less than 10. This was 10 to 30, and this was more than 30. More side effects like neuropathy related to chemotherapy, more inflammation, maybe a higher stage of diagnosis. having vitamin D deficiency and getting bisphosphonates and denosumab for bone strengthening can worsen or precipitate hypocalcemia, low calcium levels, and that's a problem too. So you want to make sure that your vitamin D levels are normal, and if you've not checked that or had that checked, I would recommend doing that. And decreased bone turnover, decreased bone density, and fractures are associated with myeloma. And then decreased survival post-transplant as well was seen in those who are deficient. I'm going to quickly talk about curcumin and then microbiome, and then we should be done. I think those were the main few things left to talk about. So turmeric or curcumin has many anti-inflammatory and anti-cancer effects, and the poor absorption of it though limits its usefulness sometimes, and it's hard to really know what the dose is and things, but there is very limited data in plasma cell disorders, and I think that is why we see a lot of patients automatically take this or read it online or find supplements. And there is also overall anti-cancer data, but there aren't any very good clinical trials to prove that really what was in the lab is what's going to translate to significance when somebody takes it. So this was the one study that looked at, the study had, it was a randomized study, and there was basically two arms, but the arms could cross over, meaning those who got the placebo could get curcumin and vice versa. And what I've shown here is just those who completed all 9 months. So those that dropped out and things are not included. And what they showed was there was a little bit of a significant decrease in the free light chain ratio, but everything else kind of didn't change. And this was with getting 4 grams per day of curcumin for 3 months, 3 months of placebo, and 3 months of 8 grams of curcumin. So every patient got basically a 9-month treatment schedule, and out of this, none of them progressed. So that's good, but it's hard to know with such a small number whether that was really because of the curcumin or they may never have progressed anyways. So the data is very limited, and that is, I think, why a lot of the oncologists or things don't specifically recommend it. But I know a lot of patients do take it. What you can do is consider taking a 1/4 teaspoon a day in your diet and sprinkling it on foods as a spice, and in that way it's not in supraphysiologic doses, but at the same time it may have some benefits. So I'm just gonna skip over this because of the interest of time, but this was just more like data that was from the International Agency for Research on Cancer that did show that specifically processed meat and red meat was associated with colorectal cancer and some other cancers too, and how the evidence was very strong. So group 1 means it definitely causes cancer, group 2A means it probably causes, and here you can see this is very these agencies are very cautious, and they don't usually say it unless they're all the data is consistent and they're very sure. So, and this is the same thing, but for myeloma, we don't really have much data, so I can't really speak for that and what you should do, but these are some of the mechanisms that may be linking it to a diagnosis, linking meat to cancer. So now let's focus on the human microbiome and some of the studies that are available for it. So our bodies are composed of more microbial cells than human cells, if you just think about how many, and many more genes, like 99% microbial genes and only about 1% human genes. And if you think about it as visible organs, yes, that's all human, but the invisible microbiome is actually much bigger, and it's very important part to make us what we are. And so these are some interesting facts. You can look at it later, but things to know is that microbiome has been linked to a lot of health problems and disorders, and we're just scratching the surface of it. And I think in the coming years, we'll learn a lot more, especially in myeloma. So this is a slide showing the role of the gut microbiome. And what you can see is there are a lot of things that affect it. These are things that you take in. In red is what increases risk of disease. In green or turquoise is what decreases risk of disease. And this is what happens with these intakes. So increased short chain fatty acids, antioxidants, improved less inflammation, insulin sensitivity, reduced infections, and all of these improve health. Now, just so you understand a few of the terminology, prebiotics versus probiotics, I'm sure some of you may have heard of it. Prebiotics is basically food for your microbiome, food for the bacteria that live inside the gut and that are healthy for them. So the healthy foods for the bacteria are called prebiotics, and they are usually fiber-rich foods. And that's why eating more fiber means more food for the bacteria. Probiotics are actually taking the bacteria themselves in either foods or in pills. So foods would be things like yogurt or kombucha or things like that, and supplements for probiotics. Diversity is a combination of both the abundance of like how many different types of species, but how many of each of those species are also there. And so you'll hear a lot about, like, in microbiome researches, is there increased diversity or is there not? And that's an important factor. This study basically is not in myeloma, but it's interesting, where it had 9 individuals, asked them for 5 days to eat a completely plant-based diet and a completely animal-based diet, and then saw what are the changes in their short-chain fatty acids, their diversity, and all of these things. And what it did show is that those on the plant-based diet obviously had higher fiber intake, but also had increase in the butyrate levels and acetate levels that are important. And the butyrates, why they're important is because they inhibit HDACs, NF-kappa B, and the pro-inflammatory cytokines. So basically, they have anti-inflammatory and anti-cancer effects. And HDAC and NF-kappa B are both important in myeloma. So I think this may be quite important for myeloma. This is now just the data in multiple myeloma. And what you can see is that unfortunately, all the data in myeloma is very early. Many of these are abstracts, so they're not even yet published papers, and the number of participants are very small. So it's only so much that we can gain from it, but we can look at overall trends of what they're saying, and we have to wait for more studies to understand it. This study looked at like myeloma, MGUS, and healthy patients, and showed that there's a difference in the microbiome in all of these different disease states. So there is some microbial imbalances or dysbiosis in these patients. This was another study that showed in the myeloma patients compared to the controls, there were more nitrogen recycling bacteria and less short chain fatty acid producing bacteria, so less butyrates. And they also used these same bacteria from the myeloma patients and put them into mouse models and showed that it accelerates myeloma development in them. This looks at diversity and said that decreased diversity as well as difference in microbial abundances were seen in the myeloma patients. So less diversity means sometimes a less robust microbiome. This study here is showing, this study here is showing that, the patients who had post-induction, those who achieved the best possible remission, the MRD negative state, had a higher amount of these 2 bacterium, which are again short chain fatty acid producing bacteria. So it's kind of similar to what this study is showing, but a little bit different too. This study, these are studies looking post-transplant, and what I will say is from the pre-transplant to the post-transplant period, what did they see? So patients who had more mucositis, meaning inflammation in the mouth or ulcers forming, they looked at that and they saw that there was decreased diversity in those who had ulcers formed, and there were more of the, a different type of bacteria, the more pathogenic kinds. This is another study that showed that those who had less diversity had more diarrhea post-transplant. This is a study which is not related to microbiome, but maybe it is, but it's not specifically mentioned in the study. So it's 142 patients who got antibiotics post-transplant. And what they showed is that those who got antibiotics did worse than those who did not. They excluded prophylactic antibiotics, meaning if it was just for prevention. And what you have to understand, though, is this decrease is probably, they think, due to a change in the microbiome, or could be other reasons too, that they were overall sicker or things like that, but it's potentially could be the microbiome. And then this study is actually starting to look at diet as well. And what they're saying is that most patients actually are not meeting the recommended fiber intake, vegetable intake, and whole grain intake. It's all lower than it, but they were not able to correlate it with the microbiome yet because it's a very small study. But they showed again that post-transplant, the diversity goes down because of the chemotherapy and everything. And the 2 patients that actually had their myeloma come back early had an increase in one of the bad bacteria called bacteroids. So maybe there is some association with that as well. This is just a summary slide of what I already talked about, but these are the factors that may be involved. This is what happens, the dysbiosis or microbial imbalance, and then these are mechanisms by which this dysbiosis can cause all of these things. So this is specifically for myeloma, and I've just summarized the available data that I already explained to you in the previous slide. So just to summarize a little bit, you can go to this website, the American Institute of Cancer Research, Cancer Prevention Food Facts. It's actually got very nice data where you can click on each cancer fighting food and it will tell you what are the active cancer fighting ingredients, how and other things like why it helps and in which cancers it helps and everything. But as you can see, again, all of the foods that they've put here that fight cancer, all of them are plant-based foods. They also say like foods to limit, again, sugary drinks, meat, and alcohol. So that's the information given, but they've written very extensively, and I think it's quite nice to understand. So if you want to understand more about specific foods and why berries are important or why different colors are important, then you can look that up. This is a slide just summarizing all the information on why plant-based foods fight cancer and how they might do it in different ways. And so just to conclude, a few things that we've talked about, that we saw that increased fruits and vegetables, whole grains, beans, nuts, seeds, and fiber are associated with health and maybe decreased myeloma as well. Turmeric, I showed you the data. It's not really that great, but because there's overall data for anti-cancer effects potentially, if you want to, you could include it as in your cooking, I would say, more than a supplement, because it's unclear, like we don't have actual true data for a supplement, but that's really up to you. I don't think it's harmful. Omega-3 fatty acids, I think, are important. Vitamin D, you want to make sure your levels are normal, and then limit these animal-based foods. What I show you here is Canada's healthy food plate, and I think it's really nice because it's very unbiased and it's very recent. In 2019 it came out. What it's saying is like 50% should be fruits and vegetables of your plate, 25% should be whole grains, and the 25% that should be protein, a bulk of it should be plant-based protein foods. So in the end, like what the animal-based foods are is probably like 10 to 20% of your diet at maximum. So I would look at this data and see if there's something you need to do in changing your diet. These are, again, cancer prevention recommendations from the World Cancer Research Fund, and same thing, very consistent. So I think it's important to think about food as medicine. It's not the solution of everything, obviously. And yes, we do have to think about treatments and all of that. But at the same time, I think we can improve our outcomes with thinking about what we do put into our mouths as well. So we're at MSK studying some of these factors in myeloma, and hopefully in the next few years, we'll have more information on it. We have a clinical trial opening on nutrition, like for 3 months, patients will be with MGUS and smoldering myeloma will go on the food plan and counseling as well, nutrition counseling, and then we'll see what the changes are in biomarkers and things like that. So with that, I'd like to end, and thank you. Happy to take questions.
Thank you, Dr. Shah, for that. Lots of information to look over. So we're at the 2 o'clock mark. We're still going to take some questions.
Yeah.
If anybody needs to leave, please. This webinar is recorded, so you can always come back to the recording and listen to the answers to the questions. I do have a few questions that came in. So please send more, and we'll be able to ask those. I'll start with a really general question. So, we saw that towards the end of your talk that there's differences in the microbiome of people with MGUS, smoldering myeloma, or myeloma. Does that in any way change? A patient comes into your office, whether they have MGUS, smoldering, or full-blown myeloma, does that change what you would tell them or recommend as a diet?
No, I think it's too early. Like I showed you, the number of patients in the study were 10, 10, and 10. I think that 10 patients is too small to draw very significant conclusions. The paper is not yet published. It's an abstract. And I think the future will be moving towards that eventually we will have clear, like we can look at the microbiome and say you have less of these bacteria and this is how we can modify it. There are foods that overall improve a good bacteria, and I think as of now I would just tell every patient to focus on that, because we don't have a good way of knowing how much the impact of food is for each patient.
Okay, that makes sense. Thank you. So the next question, someone's wondering whether there's any information or any data on, we talked about, how vegetables perhaps are a little bit are better than meat when it comes to the development of cancer. What about how these vegetables are grown and how these animals are raised, with pesticides or antibiotics? Eventually we eat these animals and these fruits and vegetables. So how does that, does that have an effect?
It's a good question. I think so there, overall I would say the impact is very small. So it's better to eat a non-organic fruit or vegetable than not eat it because it's too expensive and you want only organic. So I think eating anything that's non-organic, that's plant-based, is definitely also very healthy. Maybe there are some differences. There's one study that showed maybe there was some impact of that, and another study that showed there wasn't an impact. So I think overall I wouldn't go crazy about trying to focus on organic foods, and just go for more plant foods, and you will see the health benefits of it irrespective.
Okay. Thank you.
And yes, with animal-based foods, there is the problem that, what it used to be compared to what it is now. A lot of animal agriculture does use antibiotics and use hormones and things like that. And so I'm sure that is probably affecting some of it, where it's a lot of processed foods. But again, there's no clear-cut proof that we could say that that's really what is causing it.
Okay. Thank you. The next question has to do with stem cell transplant, and as you're well aware, after a stem cell transplant, a typical myeloma patient will have an immune system that's compromised, and so they're asked to make sure that everything is washed carefully to reduce the risk of infection, et cetera, et cetera, et cetera. So that kind of goes it's counterintuitive to what we're saying here, that probiotics are good for you and stuff like that. So can you maybe comment on the balance between that?
So some of the data about being cautious is very old data, and new studies are showing that it doesn't matter so much. But irrespective, I would urge you to be cautious in the sense of washing everything that you eat really well, and eating a lot more at home than outside. And also, a lot of fruits and vegetables can be cooked and eaten, so it doesn't have to be eaten raw. Things with skins can be eaten, where you can peel off the skin. So I think there are many ways you could do it. But if you're washing things at home really well, then I think that's totally fine as well.
And using like with vinegar and water, is that still a recommended practice to wash some fruits and vegetables?
Yeah, I mean, I don't specifically recommend vinegar and water or just water. I think scrubbing them, making sure and foods that have crevices are more likely to, have bacteria or things that could be risky, right? So like a strawberry or a raspberry has a lot of different crevices, whereas if you eat an orange or a banana that can be peeled, it's different. So what I would say is, like, if you want to eat raspberries post-transplant, maybe just cook them for 15 minutes, like a short time on a slow flame, so that they soften up, but like you're also killing all the bacteria that might be a problem before you eat it, compared to eating just fresh berries. So some things like that you can do with food that you're concerned about, where you're cooking them compared to just eating them completely raw. Sometimes with green leafy vegetables, it might be better to slightly cook them a little bit, like just steam them, because that improves the way you can absorb it as well.
Or blanching, for example. Yeah, awesome. Thank you for that. So sticking with the same kind of concept, what about eating fermented foods such as kefir or lacto-fermented vegetables, or even beer from a microbrewery? Are there any risks to eating those type of things, whether you're in the transplant setting or outside of the transplant setting?
I think with those foods, there isn't so much of a risk. With supplements, there could be, because there are much higher quantities of specific bacteria, and there are very rare case reports of like infections from the supplements, because there are bacteria in those cultures. But from foods, I think, those are probiotic foods. But if you're already eating like the prebiotics, like I mentioned, your gut bacteria are going to, just develop into those probiotics. You don't almost have to specifically take in a probiotic if you're getting the prebiotics, if that makes sense. But I think probiotics are known to be healthy overall, and I don't see a reason why you can't take them if that's something you like probiotic foods, I mean.
Okay, cool. Thank you. I guess one last question relating to stem cell transplant. I've seen, I believe it was on Vox, a documentary on doing fecal transplantations during stem cell transplant. I know the evidence is still, the studies are ongoing, that the evidence is still very preliminary when it comes to that type of thing, but do you see this as potentially in the future becoming standard practice? Is there benefit being shown at all to that practice?
I think some of the studies, there is some studies that have shown benefit, and the reason they show benefit is because you're basically taking a healthy person's microbiome and transferring it into somebody who has a disease, and maybe that microbiome makes changes into it. And we know that there are many factors that affect the microbiome. It's diet, but it's also sleep, it's also environment and other things, maybe just your own makeup of DNA and everything of what seems to be there in the body. And so yes, there have been studies that have shown it, but FMTs or fecal microbiota transplants are a bit hard to do, where you have to specifically get somebody else's stool and things. So I think there are many companies that are developing to specifically address this question, and I think we'll start seeing maybe capsules that have this similar microbiome in them or things like that, which eventually can be used, which will be easier to do and more widely applicable. So I think it's a few years away from clinical use still.
So basically an off-the-shelf product versus having to actually, take it away and okay, great. That makes sense. So the next question I have here has to do with nitrates in foods. So certain foods have higher levels of nitrates. The example given here is beets. I also believe, I think celery has quite a few nitrates, and I think also deli meats are known to have a lot of nitrates. And so is there any evidence or any information that you can give us with regards to nitrates and plasma cell disorders? Do the nitrates get converted in the body into something like nitrous oxide, which could potentially be harmful? Any information you can share?
So nitric oxide in general is actually overall healthy because it helps with the blood vessel dilation, or like improves the blood vessel. So like patients with cardiovascular disease, for instance, you want to have more nitric oxide lining your blood vessels so that you have more like flexibility of your blood vessels. Whereas the nitrites that are used for like processed meats is very different because that's more as a preservative, and that is considered bad. So the nitrates in beets, I would not think about them as bad, but think about them as actually probably good. And it's different than what the nitrites are as preservatives used.
Yeah, thank you, and thanks for that clarification, because I was getting confused between nitrites and nitrates there. So that's thank you. So not last, but so if you can send in more questions, that would be great. We have another question here.
Sure.
With regards to, I saw on one slide that we had mentioned human milk or human growth factor. What's the difference between human milk and cow milk and sheep milk, and is there any of them that are better than the other, and why?
You mean for human consumption, or?
Yes, exactly, yeah, for human consumption.
So I think nature has made it such that for humans, human milk is the best as we are children, right? Like that's why it has all the nutrients that we need to develop or grow. Cow's milk, sheep milk, they're all foods for baby calves, they're foods for baby sheep. They're not meant for humans, and in nature that's how they've developed. So us drinking those milks is not physiologic by any standard, and that's something as a community we've grown to accept and think it makes a lot of sense. I think there are some obviously proteins in them that could be helpful, but there are some things that could be harmful too, because a lot of them have these growth factors that want to help these small infants or baby animals grow very quickly into larger animals in the matter of a few months. So it has growth factors in it. It has hormones in it from the mother. And when we drink it, we're also getting those hormones into our cells and growth factors. With dairy, the association between dairy and prostate cancer is pretty significant, and there are quite a few papers that have shown the association between dairy and breast cancer and endometrial and ovarian, like other of the gynecologic cancers, is little less, but it's still there. We don't have that much information with myeloma. There were some papers that showed maybe there's an increased risk, but we don't have good solid data to say. And what is nice is if you look at a Canadian food plate, they don't really say like you should have a lot of dairy with every meal, or like the amount of dairy in that Canadian food plate is really tiny.
Okay. Thank you. So we did get one or two more questions that came in. This one has to do with, I guess we'll stick with the milk theme, and of vitamin D. I know that vitamin D is typically added to the milk, to the cow's milk that we drink. But in general, vitamin D and omega-3, are there any recommended daily doses that that you would give to a typical MGUS or myeloma patient?
Yeah, that's a good question. I think vitamin D specifically, you want the levels to be normal. So it should be based on what your levels are, and you should be checking them every 6 months or 3 months or yearly if they've been normal, just to make sure that they stay within the normal range. You have to see what the normal, like, and what the units are for where you're doing it, but about 30, I think, nanograms per ml and higher is what you want it to be. So somewhere between 30 and 70 or so. So if your level is lower than that, where many myeloma patients have it lower, they need to make sure that their levels are like they supplement or things. And the problem with vitamin D is that because we've evolved over time to stay mostly indoors, wear clothing, so very little of our skin is exposed to the UV light, and so we don't inherently make a lot. So most people are vitamin D deficient. It's probably the most common vitamin deficiency in the world.
Thank you. And what about omega-3? Do we have any evidence about that?
We don't have data to say, like, first of all, we don't really check levels. I think there are some home kits where you could order and check levels. I don't know how good they are, whether they actually mean anything, but I think what's important is if you can get enough omega-3 from your foods, then that's also good. So like including daily, like flaxseed, chia seed, or hemp seeds or walnuts or something in your meals every day is a good idea. So what I sometimes do is, like, hemp seeds don't really have much of a taste but a nutty taste. So if I'm making a pasta sauce or a smoothie or something, like, you put a little bit of that into everything. So that way automatically you're increasing your consumption and you don't have to think about it separately. If you want to do the supplements, I think a lot of the EPA and DHA supplements from algae or from fish oil, I think algae is preferable because it will have less mercury in it. Because these are, mercury, as you go up the food chain, it can increase in fish compared to the algae. But if you use that, then you can also probably daily or so, but I don't think there's data on that. And it's hard to know what levels are to know, what's right for them.
Okay, fair enough. So the last question I have here, we talked about a lot of fruits and vegetables that could potentially help someone who might not have myeloma yet, staying healthy and perhaps prevent development. What about herbs? Are there any specific herbs that have been studied that could potentially help with that regard?
So again, in myeloma, I'm not aware of any data for herbs that specifically say, like, this herb is good for myeloma. I think many of them do have, like, anti-cancer properties, anti-inflammatory properties, and things like that. So using spices, herbs is generally a good practice in what you eat and things, but I don't have specific data on which herbs. I think curcumin is the only one that I showed you the very little data that's available as a spice.
Yeah, that's
Curcumin is actually, there's some data that taking it with pepper actually improves absorption of it, so, and improves its anti-cancer effects. So curcumin or turmeric with pepper at the same time when you cook or things like that.
It sounds like a delicious combination.
Yeah.
So with that, I don't have any more questions that have come in. So with that, I'm going to end the webinar, and I'd like to thank you again for taking the time out of your busy schedule during COVID-19, which I'm sure is not easy in New York right now, and neither is it here in Canada. But
yeah.
We'll set you free, and thanks again, and we hope that that we can have you on for another webinar in the future.
Sounds great. I really enjoyed speaking to you all, and unfortunately I couldn't see your faces or talk in person, but hopefully in the future at some point. And just a small request is, we'll send the post survey out just to get your feedback, and if possible, if you could fill it out, it would help me. But it's completely voluntary. So
That sounds great. We'll do that. So I wish you a good rest of your day, and
thank you. You
all the
too.
best. Thank you. Bye bye.